Hi, Dr. Roseann here, and we're talking about a teletherapy activity for anxiety called a body scan. I'm an integrative and pediatric mental health expert who's on a mission to change the way we view and treat children's mental health. If you're new to my channel, hit subscribe and turn on your notifications so you get my videos every week. Let's dive in. So, what's a body scan? Body scan is a therapeutic activity that anybody who works with children can help a child to connect sensations to their body. You want to teach a child to pay attention to those body signals that alert us that something else is making us uncomfortable, and we need to take a moment to figure out what's going on. Maybe give a little attention to those uncomfortable feelings so that we can address them. When we deny uncomfortable emotions, often we shove them down and they always pop back up and bother us later. It's so important to teach kids that these are signals that cue us to take good care of ourselves. When we learn how to sit with uncomfortable feelings and cope, we build that all-important stress tolerance. And when we have stress tolerance, we are not ruled by trying to avoid stress and uncomfortable feelings. People often get completely immobilized when stress happens. We want to build that resiliency mindset. You know, how we view, manage, and recover from stress. And one of the key components, learning how to have a window of tolerance. And the first step to that is understanding what those sensations mean. And in my Teletherapy Toolkit book, we have a great body scan activities where we teach kids the words, and we have this beautiful visual that shows kids all the different words with pictures. And we have our body scan exercise sheet. It's something that parents, teachers, mental health providers, or anybody who works with kids can use to teach kids about body sensations and, more importantly, the words that label those body sensations. What I like to do is get kids to focus on one part of their body at a time. I tell kids, just like a copying machine or a scanner, we're going to just scan one part and we're going to see what comes up on that page. But in the case of the body, we're going to see what our body is telling us. Let's scan that shoulder. Do you feel tension? What do you think that's from? How does that feel? Did you notice that sensation another time? It gets the dialogue going, but more importantly, it starts their awareness of those sensations. And we're teaching kids about the words that go with those sensations. We want kids to quiet down and spend 30 seconds at least on every part that you're scanning. When we get very stressed, we want to detach from our body. And when we detach from our body, we disconnect from our emotions. And disconnecting from our emotions is never good. We want our kids to be resilient and strong. And that means being aware of those sensations and aware of those emotions, and then have ways to cope with it. Doing a body scan is something you can do frequently with a child. You can do before and after stressful or positive activities, something that builds that dialogue, not just the awareness of the body, but again, gives them resources to connect their sensations to their emotions. So what's my Dr. Ro? No, doing talk therapy on a highly distressed child or teen. When we're highly stressed, we have the stress hyperactivation of the nervous system. And that means our frontal lobes go offline, and we really don't have great access, if any access, to our cognitive functioning. Talk therapy assumes that we have access to our conscious awareness. And when we're really activated by stress, trauma, or dysregulated, we don't have access to the words. So coming in through the body, connecting to sensations. That's what moves the dial therapeutically. And that's what helps kids understand what their body is telling them. What's my Dr. Rowe go? Empowering kids to connect to their body through practice, labeling words and sensations. Kids are anxious, uncomfortable, and distressed, and they're able to connect to those body sensations. We need to really reinforce them and encourage them to take the time to self-regulate. So remember, if you or a child you care about is struggling, it's gonna be okay. I am here to show you how to help a child or teen you care about feel calm, alert, and good about themselves. I want to hear how you're helping children manage stress, anxiety, mood issues, or uncomfortable feelings. So drop it in the comments below. Catch you on the next episode, and remember, subscribe to the Dr. Roseann channel, where we talk about natural and effective ways to reduce and reverse mental health.